October, but.
LCAT funds.
That's an allowable expense. Almost on Amazon to see what they're spending on it.
Let's start out with some introductions real quick. We'll just go around the room, starting with Mr. Freeman.
Rachel Berry with OHA AmeriCorps in the CHIP department.
I'm Francie Winters, I'm the prevention coordinator for Lake County.
Arvinder Singh, Community Health Coordinator for Lake County, Lake Hill District.
Diane Ryan, I'm consumer advocate for Lakeview.
Jamie Davis with Oregon State University Extension Service.
Brooke Kelleher with Food Corps and CHIP.
Kristen Hill, Patient Facility Navigator.
Young Dovey, Clinics Director, Lake Hill District.
Jack Thompson, Superintendent, Lake County ESD.
Kenny Hill, Lake County School District 7.
Oh. Garrett Shaw, Lake County Examiner.
John Adams, Eastern Oregon Healthy Living Alliance.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
James Williams, Lake County Commissioner.
Susan Plantier, Revenue Cycle Director for Lake Health District.
Christy Albertson, Lake Health District Grant Gathering Coordinator.
And we have people over the phone. Could you introduce yourself?
This is Vanessa Singleton with South Central Early Learning Hub and Business ESD. And I have along with me, I'll let her introduce herself, Julie Hurley. I'm with the K Group Parenting Hub and I cover Lake County for parenting education.
Great, welcome.
And I'm also here, this is Daphne Greer, Family Resource Facilitator with South Central Early Learning Hub.
Is there anyone else? Thank you.
Okay, so we received an email letting us know that our main minutes will be available at the July meeting. So I got that in the right order. And it looks like we have John up first with our EOLA update.
So last month we asked for your guys' support in our efforts to apply for a grant to establish a Frontier Veggie RX program, and so I just wanted to come out and give you guys an update on our progress. So we applied for a 3-year, $500,000 in funding with the USDA Gus Schumacher Nutrition Incentive Program. We submitted the grant last Friday, so June 7th. Gobi is the lead applicant, and they're partnering with the Eastern Oregon Healthy Living Alliance and the Nutrition Oregon Campaign, which is it's a program of the Moore Institute with OHSU. So we're proposing expanding existing programs in Ontario, Burns, and North Lake County, and establishing a program in Lakeview. So we would be partnering with 2 clinics in Harney County, Valley Family Healthcare in Ontario, and in Lake County we would partner with Lake Health Clinic, Warner Mountain Medical Clinic, and North Lake Clinic, and the La Pine Health Center. So in Harney County, we would be reaching around 85 to 90 households, around 80 households in Malheur County, and around 35 to 40 households in Lake County. So we have a lower number in Lake County, and I'll explain why that is here in a moment. So through this grant, we'll be able to increase the vouchers that are currently being provided in the existing programs. We'll be able to increase those from $30 to $40, and then we'll be able to provide those year-round. The eligibility requirement is there is a focus on the Medicaid population, so the OHP is a requirement. We're looking at folks that have diabetes or pre-diabetic, and then there'll be an education component in Lake and Malheur counties. And so Malheur County, with their existing program, they're partnering with Familias in Action, and targeting the Hispanic population, providing AMY curriculum, and then also providing cooking matters for folks in Malheur County. Harney County does not have an education requirement, and because they have an existing program and it's not part of their.
Have you seen that written down that they're exempt?
Yeah.
Oh, okay.
Yeah.
And then Lake County, we would be also requiring the education component. So we would be looking at providing some education classes similar to Cooking Matters types of classes. So I'm very interested in what Brooke's doing. If Alana was going to be sticking around with us, she would definitely be taking those classes. But so I definitely want to get together with Brooke and find out more about those classes and the possibility of us being able to provide those down the road. So folks who are eligible will receive the $40 vouchers per month so here in Lakeview, that would be the Safeway or the Farmers Market. And I think right now we only have Shamrock Ranch that is that's a vendor through the Farmers Market that provides local fruit and vegetables, and we got a letter of support from them. And so folks would be eligible for the $40 vouchers per month, up to 2 per household, so up to $80 per household.
What all can they purchase with the vouchers?
Fruits and veggies.
That's it?
Yeah.
Fresh, or is it frozen, canned? What's it called?
Fresh.
Is it just,
If they're using what we did with the Frontier Veggie RX program, which is run in Harney, Gillum, Sherman, and Wheeler, fresh fruits and vegetables, frozen, no cans.
yeah.
Nothing added to any frozen vegetables. No cheeses, no flavoring, any of that kind of stuff. Look, it's a great question. I mean, let's say that we actually got the market in Paisley to participate. And in the wintertime, there always isn't enough choice in fresh fruits. And those towns are dependent on little markets like that where you're always going to have fresh fruits and vegetables here at the Safeway. Sorry.
No, thank you for that. So the decision, we're expecting sometime in August, and we have a projected start date sometime in October. So we'll keep everyone posted. I do want to thank you all and Singh and Christy and Nam for your guys' haste. We had not a lot of time to put this together, so appreciate your guys' support and helping us to get those letters of support. Thank you. And then I know that Alana, so we're still looking, we still have an open application right now for Alana's position. And if you have some folks in mind, please send them our way. I know that she's been giving regular updates on the Healthy Happy Smiles program. We have 2 more hikes remaining for June, which is Tuesday, June 18th at 10 a.m. and then Tuesday, June 25th at 10 a.m. both at the Sir Optimus Park. And I know that we've started conversations with OSU about partnering with them on this program, and those talks are ongoing. So that's our update.
Thank you.
Then Francie has some updates for us with the Outback Strong Resource Guide.
Oh.
Yeah, what do you have?
Okay. Yeah, I guess I wasn't paying attention. So the coalition, the United Community Action Network Coalition, when we were at the World Cafe in April, and before and then after, it keeps coming up that our county doesn't have a homegrown, locally curated resource guide. And so therefore the ones that are available, that are built somewhere else, and they're out of date, and it's just been really kind of a hot mess. And it's something that they really seem to have gotten behind and are interested in doing. Turns out, as I'm looking at the end of my 2-year biennium, that we had some funds that we could actually help that happen. and help pay for someone to actually create that and get it online. We came to you because the website that was in discussion was the Outback Strong website, which the LCAC is actually, you're actually the agency that's over that. And so we would need your permission to do that. The reason we're interested in having Outback Strong do it, rather than reinventing the wheel, making yet another website, is we don't have the capacity to curate that ourselves like that. But Outback Strong is already working on that, and the missions are so aligned. So we come to you to just say, would you give us a vote? Are you willing to support us putting that resource guide? It's $1,145 that we would be contributing to, on a memorandum of understanding, contributing to creating that resource guide, and we're asking it to be curated through the end of the next biennium, which is June 30th, 2021. And so, yeah, that's what we're asking. So if we could have any discussion, and then maybe someone could make a motion, and that would be great.
So is this a monetary, I mean, are we committing any funding or just the support of the?
You're committing to support, so there'd be some time to the actual, like I said, the curating. If somebody goes out, some agency goes away, or the number changes, you've got somebody already working on the Outback Strong that would update those things. We did put into the memorandum of understanding that we understand that if we add extra things, because there's something going on, an event or something, it all has to fit within the guidelines of what Outback Strong already is doing, and otherwise, it's a no-go, and that's just understood. So.
Okay. No.
So is the breadth of the information in the resource guide similar to 211?
Yes, but updated and current.
Right.
Yeah.
Well,
Yeah.
I don't mean to be disparaging
Yeah.
or anything, but yours will never be current either.
We're hoping it will be.
As soon as you post it, something's going to change.
What we find is that people, and 211 was brought up, and people
we
did.
talked about
Yeah.
it. But it's 211 is the phone number. 211info.org is the website. And that's pretty current. I just updated again.
Did you?
Members get an email, you update, and that's how it works. Sorry.
No,
But it's good that it would say utility help, pay with your bills, help with your bills, or those kinds of things.
Right.
Social determinants.
Yeah.
Even stuff like youth soccer signups, like all of those kinds of things. That was what my understanding, what the vision was for all of the resources like that, healthcare, whatnot, but all of the get your kids involved and you get involved in the community kind of things as well.
Yeah.
Kept hearing people at the World Cafe, a lot of it was like wishing that they knew about volunteer opportunities. Yeah. And like what programs are going on that they could kind of put their time into. So would that be included?
I mean, it could. We're in charge of what we say. We're asking that resource guide to be, as far as the coalition. I know a lot of you members, our people are in both locations, so both groups, yeah.
Where were you?
Francie put on, it was called the World Cafe. It was for the UCAN. It was just like a community.
Countywide strategic planning session.
All right, thank you.
Yeah.
Francie, who put this one together?
That was Amy Riches, I believe.
Oh, okay. Because it says your community resource guide.
Right.
And when I look at the services we provide, it's incorrect.
Yeah. And they sent it to some people, and one of the things that I had with that was like, and this is a discussion that somebody has to have, and that is, should we really be doing advertising for profit businesses that are in there? And they left out other services that are social services that are nonprofits, but then they included
But we're a
for-profits.
nonprofit.
Yeah.
We're not.
Oh, I know you are, but there were others, and I was like, wait a minute, I think that's maybe not, but that's a discussion for it spells it out that the coalition membership will go to and decide on design, and then they'll design it, and then they'll come back and approve it. Then we understand that it wouldn't go live till like September, so.
I had a question. How are we segregating the funding of over $1,000?
It is funds that I have left in the HIPCDIP
Yeah.
and from a bunch of different categories that, but actually 1,000 of it is under the coalition or youth leadership events
Okay.
and programs or projects. And so it made a lot of sense to just take a little bit from something else and make that happen. If the group isn't supportive of that, and that's fine. If it's redundant, we'll just do something else. So that's why we're asking you.
And this is a use it or lose it for this money.
Yes, it's use it or lose it. No, don't worry, I'll use
Is
it.
there a deadline for the user?
Yes, June 30th.
Okay.
Oh, so coming up.
John, you had a.
So we developed, through this Community Advisory Council, a resource guide through the first community health assessment and health improvement plan process, and I'm sure it's outdated, but it's pretty comprehensive in terms of listing a number of the social service organizations and other types of organizations that can support folks both within the county and kind of, regionally, so looking at like Klamath and Bend. And I can share that with you.
And is it
if
print
that's
or is it
helpful.
online?
I have an electronic copy. I know the health district used to have a link to it, but I'm not sure anymore.
It's a PDF though, right? I mean, it's
It's
not.
a PDF.
Versus that was one thing that came up, I think at the last UCAN meeting, I missed World Cafe, so correct me if you guys were there. But the idea of it being searchable, so like you said, searching for volunteer opportunities, searching for services for seniors, or being able to.
Well, it'd be great to have and I've collected them. Gloria's given me some. I've collected a bunch of them. I have a file of them. And when anybody says, oh, we want to do one, I'm like, okay, here's the file. The last one that I know of that was done came out of Klamath. And yeah, I mean, this doesn't have to go this way, it's just an opportunity, so.
Right.
And just a resource guide that has like prevention, here's their number. It still doesn't have what programs you're doing, and those are always changing.
Good.
That's a lot of, programs between different groups, they're different monthly.
Oh yeah, wouldn't have a month. There was a discussion about a calendar, but that with Outback Strong, and Outback Strong has not made that decision yet, whether they're going to have a calendar or not, because there's so many other calendars in town, and we don't want to, be redundant that way. So.
I just Googled it, and so Lake County has a link to that health resource.
They still do, okay.
Yeah, health resource directory.
Okay, so yeah, if it's redundant, that's fine. But you guys just think about it.
Well, that's just for health resources, right?
Health resources.
Yeah, not for like
Not for community.
It's pretty comprehensive. I mean, I think let me see.
17 pages worth.
Oh yeah, that's pretty comprehensive. 17 pages.
I mean, I want to say that there's the energy assistance in there. Yeah.
Energy assistance and all that is on there.
The number may have changed, the address has changed, I mean, all of that stuff because classes.
Right.
Yeah.
But it's also an opportunity to further brand Outback Strong.
Yeah.
That's a good idea.
And if this is going to act like what the yellow pages used to do, there's opportunity to give people a chance that are listed in there to be displayed more prominently. Whether it's, if they want to pay, that would help support.
Yeah, they
over
would have to
time.
pay it.
Yeah.
Not, the others would be nonprofit, so they don't have to pay, but it's an idea, yeah.
Well, Garrett can tell you that advertising is down
Yeah.
for print media, but it's up for all electronic. I mean, you can't get onto a web
That's
page
right,
without
too.
getting
Yeah.
into that now.
There was discussion about the volunteer issue and about the need for faces because of the way our community functions, the need for faces to be given to some of these places or organizations so that people felt more personal, so that when they came into town, we were looking for something.
Right.
It wasn't just a number to think, maybe some things have pictures or whatever. So there are some design elements that we thought might be valuable, but, yeah.
I think if it's not a monetary situation, I mean, what does the group feel about being able to, supporting that endeavor sounds reasonable.
Well, I know for me, of course, I'm just one dinosaur without a computer and anything electronic, but when I see a phone number from Klamath Falls, I won't call it.
I know.
Because I figure my name will be getting on the bottom of the list, if at all.
What I would like to see happen is that if we can prove that that's being used, then potentially we could get a print version, we can get someone to pay for a print version via grant, or we include it in one of them, whatever.
Yeah.
But so that, because where I'm from, we had a strong coalition, they did them every 2 years, they did have advertising, you could be more prominent in there, but they went like wildfire. I mean, because they were really a nice little guide and they were right there and it had everything.
Yeah.
So potentially that might be able to happen, but I'm not promising that, I'm just waiting to see if the traffic bears that.
Well, and to your point too, Diane, there are other organizations and movements underway to get some of those Klamath Lake agencies based in.
Yeah. And there's a lot of seniors in town that don't have computers.
Right.
If they do, they don't use them.
Yep.
They either don't want to or they don't know how.
Yeah.
And if they don't know how, a lot of times they're too embarrassed to ask somebody for help. But I go to the senior center 2 or 3 times a week. And one time they were closed and they said, well, go to it's on the internet. And I said, well, you can, never mind. I said, I don't look at the internet. And then somebody said, well, go to the library. Well, the senior center opens up, after the library, before the library does. So anyway, I'm just spouting off. But like I say, I won't call the number if it's not a Lakeview number.
So
To
do
help.
we- sorry.
Not even yours.
So do we want to make a vote for supporting the resource guide or leave it in a discussion phase? We don't have too much time, right? The deadline is June
She
30th.
needs a decision today.
So how do we go about voting? Everyone?
I would entertain a motion to support the
Resource
Outback
guide.
sign,
Yeah.
Outback Strong
The
Resource
local
Guide.
one, yeah.
If somebody would like to so.
I'm on for it.
Is that a second?
Well, I can't move, somebody needs to move.
And she
And there's
did, are
somebody
you
to
bringing
say
me?
so.
I'll move it.
There you go.
Yeah.
Do we need a
Is there a
second?
second?
I'll second.
Okay. All in favor?
Aye.
All opposed? Perfect.
All right.
Motion carries. On that same note, I'm just gonna pass the group really quickly. I noticed when I was sending the letter for John that we don't have a letterhead. So it's difficult to support things when we don't really have that brand. And so Christy had a great idea about maybe incorporating part of that with Outback Strong and how do we, or very quick discussion on, does anyone have an objection to us creating letterhead so that when we are doing official supporting of other things that we have something that, I mean, I can't put it on Lake Health District letterhead. You
There
can.
is letterhead available.
Is there?
Yeah, each county has one. It looks just like this. It has the EOCCO logo and then it says Lake County
Okay, well, then
Advisory Council.
Can you send that to
Okay.
us?
Yeah, our vendor should be able to get it from the link with Jeanette, where all the resources
Oh, okay.
are. It's on there, one that says letterhead.
And are there rules about not adding the Outback Strong onto that, or can they add it at the bottom at the end by something or something?
There aren't really rules,
There aren't? Okay.
so
I just knew I was sending him.
ask forgiveness
I
after.
think that would be cool.
I just didn't want to create something without, but I felt bad sending out a letter that wasn't really, I didn't feel like it was as official as it could have been
Right.
for us.
It'd be great to have Outback Strong seen more and more. So if there's no rule against putting it on there as well, just say
Well,
that.
but see, EOCCO provides funds for Outback Strong, right?
Right,
Not necessarily
exactly.
endorses it because you guys
Right.
make that decision locally and deal with that. So you could actually have 2 different
Yeah.
letterheads.
We could.
But if it's an LCAC letter of support, it probably should have the EOCCO logo.
Yeah, perfect. That fixes our issue. Okay, so our vendor has community health plan discussion and SHIP updates.
Thank you, Susan. So I'll start with the community health plan. So in your meeting packet, there is a rough draft for the community health plan. So a couple of months back, I had sent out a survey to the council and the community members to vote on what they feel are the priorities for Lake County. So we have 4 priorities that we want to work on with our community health plan. Then me, with the help of a lot of people who are present here, I have been working on making a community health plan which is focused on those 4 priorities. So the same information is on the board behind me, but if for some reason you have a difficult time making out, you can refer to the packet, to the draft which is in your packet. Let me just move this here.
Did you write all that?
Yeah.
That's really nice.
Good board handwriting.
I thought that he was just claiming that.
That must have been Chrissy.
That's what I thought too.
Is that
I think he needs to make all
I
those.
think Miller Poster did.
I thought I saw Francine at the board when I walked in.
That messy part.
That's as neat as a woman writes. Are you well, Dad?
I wish my mom could hear all of that. So I'll give you a quick breakdown. We have our 4 priorities on the top. We chose for early childhood trauma, food insecurity, substance abuse, use and addiction, obesity and chronic diseases. So how I went about with planning for each of the priority was to first find out what the problem is, to identify the problem, then to come up with a goal that we want to achieve with the community health plan, then how we will get to that goal, the action plan, and the funding sources, which we can never ignore. So starting, and again, this will go through more changes. This is all the information I could get from through networking and just connecting with you people, but we can discuss and make some additions or remove some items which you feel are not necessary. So starting with the early childhood trauma. So why is that a problem? So adverse childhood experience affects long-term health. There was a study done by Kaiser Permanente and CDC that says that children with adverse childhood experience, they have a severely higher risk of having health problems when they grow up. And in many cases, the study has shown that the lifespan reduces by 20 years for these people. So that's definitely a problem. Doing the research, I found out that one of the goals towards early childhood and trauma should be that we should implement an ACEs awareness or trauma sensitive training program with the Early Learning Hub. ACEs again is the Adverse Childhood Experience Score, and our wellness center uses that, and that's a good way to gauge. And the higher the score, the higher your risk is of having problems later in your life. How the plan was to go about getting the ACEs training done, or whom to give the training to. The idea was to train local healthcare workers, DHS workers, school teachers and counselors and other stakeholders in identifying child abuse through ACE awareness, trauma sensitive training. Basically, anyone who comes in contact with children, it would be beneficial if we could train them. So that's one goal and that's one action plan. And I also want this to be like a discussion at the same time. So can anyone, are there any comments on this particular goal?
There's been some training, right, Francie?
There was we did trauma here, and then Daphne and Julie Hurley, are you guys still on the phone?
I am, yeah.
Didn't you, wasn't there Early Learning Hub, didn't you guys just have a childhood trauma informed care thing at the library? Training?
So we did a growth mindset training, and then we did additionally children, like social emotional training for children, for childhood emotional social training. Was for parents and people who work directly with children.
Okay, well, that's a start.
What about if we throw in something like motivational interviewing training for healthcare workers? Because a lot of times whenever you're talking to kids, there is sometimes a barrier or people do not understand how to get the information from them without making somebody defensive. And motivational interviewing comes up quite a bit. It's evidence-based. So I think if we can do that training for healthcare workers and other people who come in contact with kids, that might be very helpful too.
Okay. And it's called motivational interviewing training. So are therapists trained in this?
Usually they are, but I'm thinking more like medical assistants, nurses, they do not have this professional training.
Okay.
Mental health therapists and other folks might have that. And as we are doing more behavioral health integration in primary care, I really think that if medical assistants and other folks can identify this and be more aware, like this person might need some help with a social worker or therapist, that might be helpful to get more people in for their
Well,
care.
and that would probably lead over into the substance use addiction and possibly even the food insecurity, those motivate, that type of interviewing style would cover a lot of,
right.
We might be able to.
Okay, so it's generally meant to change a behavior, motivational interview, by eliciting from the subject their reasons for wanting to make that change. Whereas I think if you have, and I'm not disagreeing with that, we couldn't go across several of these areas, but you know, the trauma-informed care is recognizing that even adults who experience 3 or 4 of these things, you approach it differently. You can re-traumatize people by getting them, you know, to actually re-experience what they did when they're telling you, you know, what it is. Because it's not like, you know, it's the question is what happened, you know, not what's wrong. And you know, so I think it's a broader than the actual eliciting of, you know, your motivations for change.
Right.
And if you're talking about, I mean, I think you're on the right track, and I think what he's saying, it goes clear across, that's great. But when you're actually talking about children, early childhood, I think that we need, they would need training that's specific to how you're dealing with children. And I think we would have to lean on our behavioral health, our mental health, our wellness people. And if they can't do it, then train others themselves. Maybe they know who would be good, or Gobi would know, right?
Right. Is this priority, and this might be beyond the bounds of this group, but we've talked here and elsewhere about the fact that Lake is the only county that does not have a court-appointed special advocates program. And you mentioned in here, your data includes the number of kids in foster care, and that's
Right.
CASA.
CASA.
We used to have.
So this is just where we get, you know, you guys kind of maybe figure out what you want to bring. I think through the, again, parenting education collaborative, they have a lot of great speakers who have this kind of background. And so, you know, if you guys need help maybe figuring out who to bring, I think both the Early Learning Hub and the Take Your Parenting Hub can probably help there. Find some good people to bring in to Lake.
Do you have any contact names?
Yeah, I can look and give you guys the names. I don't have them off the top of my head, but
okay. Yeah, that will work.
Christy?
Yeah, then we the Oregon Parenting Education, they're always giving us guest speakers. They help us coordinate them, and we try to bring them to the different communities. So, you know, if we have a need, they might be able to, you know, if I say I'm looking for ACEs specifically for children or for adults, then they probably could help me find different things.
Okay. Thank you.
And get us names.
Christy, you were saying that the court-appointed advocate, who does that person work for? What ages?
I don't, does anybody know that? I don't know that, I just know that they're
I think they're usually a
programs.
nonprofit.
Volunteer.
It's a volunteer?
Right.
But there's a coordinator position that would be
And
funded. somehow.
And where does that person normally reside?
It used to be out of the courthouse when we
Yeah.
had it. I don't know what program they're working for. It hasn't been gone that long.
You have
I think
legal
it was
aid
the
next
last
to the
person,
Who was?
the last person I think who was heading it up retired or was done, and then it went away. Nobody filled the position. I can't remember. who
Well,
the-
Marcia, who
Yeah.
used to be the
Marcia
director. Mhm,
That's
but then there was Pam, but I can't remember.
COVID?
Yes.
That's right,
She
okay.
was the last
Yeah.
person.
And I was at a conference in April and met the gal who is the coordinator for Harney and Grant counties, and she was so excited because she was a one-person department, like 0.7 FTE or something, covering 2 counties, so now she's full-time based in Grant County and has a full-time person in Burns, and there are discussions happening at the state level trying to figure out how to get CASA back in Lake County. And the Grant Harney, like, they are maxed out, they can't take on another county right now. Klamath, we have issues with Klamath anyway, but Klamath doesn't have the capacity to take it over either, so if we could come up with something, the state would be so excited. And it would benefit all of these kiddos who don't have advocates speaking solely on their behalf in court.
So how can we go about who would know where we would look to find out what the requirements are?
I've actually been working on that for a little over a month now.
You have?
Yes, sir, and you had given me the number of the woman that I need to call back. What was her name?
Marcia.
Marcia.
And
Okay,
I
so-
talked to her and gave her your information.
Yes, and she called me, she put me in touch with Marcia, whom I'm gonna call to get a little bit of her information on it. She knows much more about how it will work in the county, but I've also talked to them at the state level as well.
Okay.
So I could write up something if anyone's interested in seeing the packet.
I'd be very interested.
Okay.
Because I think that if we can find out how to bring that to us and figure out what way, if it needs to be a nonprofit, well, we have several within the health district. And if that's going to help the at-risk population that we are covering through our EOCCO, then it certainly makes sense for us to be involved in helping that process.
Great.
Did that person need his office space at the courthouse?
I would think possibly. Do they have legal aid at the
We
courthouse here?
have a victim's advocate,
Okay.
but I don't think that's the same thing as what you're talking about.
No.
So,
No,
it's for kids.
She's a crime
For child-
victims advocate.
for children?
No, for anyone in the criminal process, for adults. And
Yes.
it would be children, but generally, they work with the adults and the DA just to
Correct.
support them.
Correct.
Rachel?
Yes,
Um,
it's different.
Yes. All right.
So the former director for CASA for Grant Harney County, Tracy Blood, she's now the executive director with Prevent Child Abuse Oregon. And if you reached out to her, I think she would be very helpful in giving you information on what's needed to get it started here.
John, have you got
Thank
her
you so
contact
much.
information?
Tracy Blood.
She's the chair of the Grant County CAC and Linda Watson's daughter.
So at the RCAC, we might see her.
Yes.
Did you have her email up on that?
Yeah, I can send it to you.
Okay, thank you so much.
If you could also stay in touch with me if we are going to be providing someone else additional office space in the courthouse, that would be nice to know.
Right.
Someone used to be in there though.
We're losing our victims advocate, but we're in the process of remodeling a bunch of things upstairs. So it might be nice to know that ahead of time as we do our remodeling to incorporate that in the plan.
Okay, great. I will keep you very closely aware.
So just an overall comment, you know, a plan is a working document, it's like a budget. You know, I would say put it in, you do something, you find out whether you can make it happen or not, you take it out when you need to, or add some new idea in later on. So it's not carved in stone.
Yeah. Just to offer a strategy idea also. This is also a regional priority, and the strategy in the regional, or a strategy in the regional plan is the integrated nurse home visiting program. So this directly addresses this issue. And so we're currently piloting that program in 4 counties, and we've established the program, and we're working to really kind of ramp up, get more moms connected to mental health support services through public health home visiting programs. But I think once we get it up to a point where we're successful in being able to successfully connect numbers of moms to therapists through public health home visiting programs, then we're going to want to reach out to other counties. So if this is a multi-year plan, then maybe that's something that could be a possibility down the road.
This is a 3-year plan. Correct me if I'm wrong, Paul. The community health plan is for the next 3 years?
It's supposed to be 5, but
okay.
I suspect it's going to change.
Is this an EOLA activity?
So it's been a strategy within the EOCCO's regional plan, and we started it last fall.
So EOCCO's, not EOLA?
Well, I mean, there's a relationship there. We focus on health priorities, regional health priorities and strategies within the EOCCO's regional plan. So we're helping to raise resources and implementing programs.
John, do you have a rough timeline for the nurse home visiting program?
I mean, I think it's going to take us another year at least to get it up to where we want it, and so we would be looking at
late 2020.
Yeah.
So that's some productive extra information that we can add to our goals.
And add CASA, because I know you're going to take a picture.
Yeah, I thought.
Well, that child advocacy was actually CASA.
Yeah, that's CASA.
But I would write CASA down next to it so you remember what that was. Court appointed special advocate.
Can we think of any other additional goals to what we've already discussed?
For priority 1?
Yes, for priority. Yeah, we are still in the priority 1.
I think this is more of a wellness question, but I would be curious about using more EMDR training for our clinicians.
Sorry, could you repeat that?
This is EMDR training.
EMDR?
What does that stand for? Help me.
Oh, it's a clinical, this is why I'm saying I'm not my boss. It's a therapeutic modality that they use in therapy kiddos. Well, for anyone, but I'm just thinking expanding the therapy options we offer here might be better overarching.
And before we submit the final report, I will share it with the council to review it. Can we think of any more action plans? So we have a couple of trainings.
Julie mentioned parenting.
Yeah.
And so something about the parenting classes, so you're just supporting perhaps or something, parenting classes in your action plan. Because those early years are just so critical and the way that everything develops. And it's really, really hard to change that human being after the fact if they've gotten high ACE scores in those early years. So parenting becomes really key, you know?
So you said parenting classes?
Yeah, I would agree, Francie. I'm glad you bring that up. I think it is really what has driven these parenting hubs across Oregon is about trying to minimize ACEs by getting to the parents to help them have the right skills for parenting and understand the impact of nurturing parenting and managing their own stress levels, addressing their own traumas, and that type of thing. And it is the type of training we are trying to bring. to the county. And so, I'd love to kind of see how that can tie to the training we might bring to professionals.
And the other piece that can mitigate that high ACEs score is resilience. And so I know that goes hand in hand with that. And you mentioned that when you're talking about what is nurturing parenting. So that's real important for us to raise awareness about what, therefore, builds resilience, especially if you're talking about a high number of foster kids or kids that, have already had that trauma. How do we combat that? How can we fix it? We just can't throw our hands up in the air and go, oh, okay, whatever they got, they got.
Right, so we also work to try to provide training to foster parents, because they could be that key to resiliency for these kids. And so I think there's a lot to that, and that's kind of what's built into the different type of parenting caregiver education we try to provide.
Thank you. So far, so good.
I'm gonna ask you, so does the ESD here, the ones who have the wraparound program?
The wraparound.
Yeah, let's say that, someone in the community, one of the early learning hub providers does a developmental screen for 0 to 36 months old, there's something wrong, it's confirmed by a clinician. Okay, we screened them, they're not socially, emotionally ready. It's your shop that gets that referral, right?
Right.
So
yes.
What people are there, are there people there that can help with this?
No, I mean, our program is we specifically work with the special needs child. We give speech therapy or other therapies and things that we do with early intervention.
Okay.
So, or birth at 5 years old. Once they turn 5, then they go into the school system. But we have.
So it's special needs children, not those that are just traumatized.
No, we're only special needs.
All right.
Yeah.
Paul?
Yes.
I just
So this
attended.
is Vanessa. And we, I have the Home Visiting Systems Coordination Grant, which we also can call Community Uplift. And so we do have that initial referral that we are connecting families and children to what resources are available in Lake County. So such as Head Start, your public health nursing, EI, which is SAC, and then Healthy Families of America, because I do know you guys have 2 Healthy Families in Lake County, which I work with both of them actually. So we do have Community Uplift, connecting those families to services.
I just wanted to add that I attended the mental health advisory meeting. I think you were there last Friday, and they discussed the mental health advisory group is basically assisting through mental health to offer and educate members and community partners, medical professionals, the schools, to do the referrals for wraparound, and their Oregon Health Plan right now doesn't offer the opportunity to non-Oregon Health Plan recipients. And so I know that the Wellness Center is working on making that a part of what they're going to do. So we'll separate into a committee, and then look at the referrals and then decide to go forward with that. I think that's what was discussed.
Right.
So this is Vanessa Singleton again with Community Uplift. And one of the things I forgot to mention is we actually are starting to refer also to you guys the Wellness Center over there that does your parent-child interaction therapies. So I think we've done our first book for those last week.
That was starting in October.
So next line item is the funding sources. So far we have GOBI, OCF, and the family,
Ford Family
Ford
Foundation.
Family Foundation.
Yeah.
Um,
Both Oregon Community Foundation and the Ford Family Foundation are very committed to programs that help kids and have some specific dollars that we could go after. Probably Meyer does too, I'm not sure off the top of my head.
What's the timeline for that money, if we could get it?
Their community, OCF's community grants program is a rolling deadline, is that what she said? So
Yeah.
that one is oh no, it has two, I lied. So we could apply by July 15th and have funding starting in November, or the second deadline is January, and it would kick in whatever, however many months later. Ford Family is the one that has the rolling. But that one, I should say that Francie and I have submitted a proposal to support the methodologies programming in our Lake County schools. So if we get child, youth, and family money for that, then I don't know that we could get more child, youth, and family money until that grant period is over.
Did anybody here submit for the Gobi funds on early childhood?
No.
Okay.
We had
You
a
did?
plan, but we didn't. Our plan involved hiring people, case managers, to work in schools, and we didn't have a way to sustain those positions in the long term, so we didn't apply.
Okay.
Paul had a question about funding. So you said we can assign LCAT funds to these priorities to the committee health plan.
Yes.
However, for 2019, all the funds are already allocated, so.
Yes, they are.
So then we can only, LCAT funds, we can only plan for the 2020
Yes.
cycle, okay.
And it is official, we get 100% of the withhold back.
Good.
Okay.
We had 14 to 17 measures. And so you'll get at least what you got last year plus a couple percents, and it may be more depending on how the other CCOs did. Because if they only get 80% of their funds back, that 20% is distributed to the people who got 100% back, so we'll see how it works.
That's money we'll see in September.
No, it'll be made available for you to apply for in December for next year. September is the admin funds, the 10 to, and I'm trying to bump it up a little bit because there hasn't been a bump in a couple of years.
Excellent.
Do I have any comments or questions about the first priority, or should we go to the next one?
So even though it says funding sources, I mean, your partners there on the phone are, it's in-kind funding by providing the trainers and that kind of stuff. So make sure you list them as part of the plan.
Next priority is food insecurity. Again, the problems that were identified with that is that we have limited access to fresh fruits and vegetables in all over Lake County. We also have a very limited SNAP benefits program, and also SNAP can be used at a farmer's market, and we don't have a very regular, consistent farmer's market. So for the goals for this priority, what we came up with was, first was to implement our Frontier Veggie RX program in Lake County. There was discussion that we have a Veggie RX program in North Lake, but doing more research into that, I think again we don't have an established program in North Lake. I doubt we have any contact also. Right, Rachel? I think we both were trying to get.
Yeah.
Well, we have the LCAT funds that were part of the application that went to the Lapine Health Center have a food program.
Yes.
And that's what prompted the USDA grant to involve Lake County in general. It was the other places that were not doing Frontier Veggie RX, but had, some two-off, smaller version of it.
Yeah.
So, I mean.
Yes. So that was the first goal. The second goal for food insecurity was to increase referrals to Lake County Food Share Pantry. Of course, that comes with its own set of issues, as we have space and access issues. And there's a lot of confusion about what the food chair does, what the food pantry does. There's also Food Bank, which is not in Lakeview. It's in Klamath. Our next goal is again to focus on the farmers market, have a seasonal functional farmers market. We have also been working on that. I know Food Co. Brooke Kelleher has been conducting a lot of meetings, trying to get some structure with our farmers market. And Diane had said that the farmers market starts on the same day as Daily Days.
Yeah, yeah, maybe some of the booths here, not all of them.
Okay. And again, we don't know how consistent that will be. If we have a proper functioning farmers market, that really helps. And if we could make a collaboration where we can use the Frontier Veggie RX program or SNAP benefits at a farmers market, which is being done in other counties, that would be awesome. And also the last goal is to support our food gardens at our local schools.
Brooke, did they finally get a curriculum that follows anybody's school, Brooke, their school curriculums to use in the garden yet? Have they gotten funds for that yet?
So we're just following the food core curriculum right now. I don't think there isn't a set, as far as I know, a set nutrition or garden curriculum by the school district. Is there a nutrition?
Well, not that I'm aware of, no.
Okay.
Nutrition pieces we have, we teach health classes.
Yeah, and there isn't, I don't think that there's set standards for that, but that is something.
Because Nevada has one that was created by AmeriCorps, and we've talked about it before, but I wasn't able to find a way to fund it through my grants, but there was discussion about having that because they have it from K through 6 or 7 or 8 or something with every subject to handle all of them in a garden, and they're all school subjects, every subject. And it's not overly expensive, but if we went for that, that is something we might be able to purchase finally for those schools if they were interested.
I think before jumping into that, it would be good to get the more teacher engagement with what's already happening now. So more buy-in
I
before
really
we
want to
just.
talk to my principals and the teachers involved.
Yeah, I don't want to just say, here's some curriculum, go do it. And so I think that the food core curriculum is really good for right now, just because they are starting to push more though for us to co-teach with the teachers instead of me just taking their kids and them, getting stuff done while I'm with their munchkins. So hopefully we'll see that.
Brooke, can you give us an update about how the farmers market meetings are going? Is there any structure or what are the issues with it? I know one thing we discussed was that we don't have that many farmers.
Yeah, I think that's probably the biggest thing. Like you were talking about maybe having a year-round farmers market, but I think everybody knows there's not enough growers and producers in Lake County for something like that. But there is a lot going on in Surprise Valley, Alturas, and Klamath Falls. So collaborating with them, I think we would be able to get to that.
If limited access to fresh fruits and vegetables is one of our issues, Paul, you mentioned Paisley, they have nothing. So what up there can we do to get better access in Paisley right now?
Well, I think, if you talk to the people in Gillum, Sherman, and Wheeler, which are small towns, right? Their biggest thing about the Frontier Veggie RX program is that there are now fruits and vegetables actually in the store for everybody.
Okay.
Not just those with the coupons.
Right.
So it's improved overall access to fruits and vegetables. But there's no reason why we couldn't, once this program's up, if we get funded, why we couldn't go to Paisley or
Christmas Valley.
Does Blush have a market?
Yeah.
Christmas Valley.
Yeah, I mean, there's no reason why we couldn't approach those businesses. We have the same processes for other places.
Christmas Valley actually has a farmer's market. They had their first farmer's market just recently.
Nice.
They had 3 vendors. Yeah, that was it. They're trying to get Sid's Produce to have a little stand there as well, because he has traditionally some of the best produce in town, and he is year-round.
Yeah.
And he actually does a really good job providing that access to fresh fruits and vegetables.
And he does
year-round.
come to Paisley, what, once a month-ish?
Correct, he does. He does Paisley once a month. They have a little big yurt they set up, and he sells produce out of that.
Yeah, there's a guy named Hans drives around all those little towns and does that up there, and he's a main contractor for us, so.
And they do really
There's no
well.
reason why that couldn't happen. But, you know, if you just have it in the plan, then once we get the funds, then it's easy to bring on other vendors.
Could some of the funds support like freezers or stuff to, because I think that's one of the challenges with having fresh produce in a store, like just cooler space.
We haven't been able to do that.
Sorry, I was joking.
Does the food share food pantry, do you guys have refrigerator, freezer?
Yeah, can they support?
Pardon me?
Do you have refrigerators or freezers at the food share
that's
or
my
food pantry?
We have them at the food chair.
Okay.
Yeah. Yep.
That would be a requirement from OHA around nutrient drains.
Rachel, your that includes the figuring out how to do Brook-like food core work in other schools and with older kids. I don't know if that's something we build into, because this is very Lakeview focused.
Every time I see Luann from Plush, she gives me a hard time because Rochelle used to go out to Plush.
Yep.
And I cannot, it's not under, they changed it with food court. So I know that is like, there's a need out there.
I'd love to give it
It's a nice little drive.
Yeah, I did that the second year I was here, so.
Yeah. I don't know if that can be included. I think that would be a really great thing. Especially if we're getting more fresh produce into those places at the same time. That would be like a,
Yeah.
Luann was really involved in helping to lead like the food assessment,
oh, okay.
food systems assessment
That's right.
a couple years back, or a few years back.
Brooke, do you know how many vendors we have in Lakeview for the farmers market?
Oh, not off the top of my head, no.
Okay.
Have they talked at all, do you know, about becoming a 501c3 so that they're a formal organization and they can?
It's seems, just by the sounds of it, over the few years, it's like less and less involvement in it. And they're kind of just like, just doing what needs to get done to get through the season.
Darwin, I don't know this is a business thing, but is there anything we can do to get bountiful baskets?
We're still waiting to hear more from Bountiful Baskets as they continue to try to re-expand after they lost their shipping vendor. So as soon as that's back, I mean, she's checking in all the time. So
That's good.
they are expanding though back in Oregon, so it's just a matter of time.
Somebody on the phone was trying to chime in.
Hello, this is Vanessa and Julie. We're going to have to sign off. We have to go to another meeting. We just wanted to thank you for inviting us, and we hope that we can attend in person next time.
Thank you.
Thank you.
Thank you.
Bye.
Bye.
So those are the goals we discussed for the action plan to achieve those goals. First action plan was to support whatever our plan or the program is through LCAC funds, also through VeggieRx if we can launch that. Second was to serve as a local liaison between the Frontier VeggieRx program and the local clinicians and vendors. So they can be prescribers for healthy food. And also to create a plan to establish SNAP point of sale system at farmers market. One of the data that we found out when we were researching food insecurity was that there's easily more than 1,000 people who need SNAP benefits in Lakeview itself, and I think the total people who use SNAP benefits in 2017 were like around 400 or 500. So definitely there's potential to increase the SNAP program in Lake County.
What about summer lunches? We're using Outback dollars right now to support our paid positions. And that addresses the food insecurity piece.
We've also talked in the past about the backpack program for weekends.
That happens up north.
Yeah.
They do have the backpack program in
Yeah.
North Lake.
I think with the backpack program, there's so much food that at the end of at the end of lunches, when we're there, that's just, they're like trying to get it up to kids, like, come on, please have seconds, we don't know what to do with all this food. So, yeah, that might be a way to look into it. I saw some things online, some schools that they had to-go boxes that they would send home with students in need or kids at risk.
What I like about the one in Christmas Valley is that it's like the teachers know, and so it's not other people don't know, it's just the kids go home and it's in the back, so it's not that whole stigma of, having to ask or take it with you or
With the
whatever.
bar of soap and other personal hygiene
Yeah.
items included in it.
Yeah. I mean, their need is a little bit different than ours, but I feel like there are a lot of students that could benefit from a similar.
Yeah, I would add the summer food program since you funded it in the past and just get a line in there that says supported and they do advocate for it.
Going back to the Frontier Veggie RX program, so Paul, you had some criticisms about that program. You said that the money runs out in like a couple of months. You've given an example for Charlie's favorite county, Harney County.
Well, yeah, I mean,
I thought that was Klamath.
This.
Depends on what they're.
There's a lot of competition now.
When I compare a county,
Got it.
good things and bad things on both counties.
All right.
No, it wasn't a criticism. It's just that, both Harney and Lake County have about, 1,800 OHP members.
Okay.
Gillum, Sherman, and Wheeler screen everybody, and they'll give that resource to somebody who's on Medicare, 65 plus. That's why they're excluded from this grant, because this grant that we're getting from USDA is just for Medicaid and SNAP recipients.
But a SNAP recipient can be a Medicare recipient.
They can be, yes. Medicaid.
Medicaid?
A
I thought
Medicare
you
patient can be
said
Medicaid.
over 65, someone is eligible for SNAP?
That I don't know.
Where'd you just tell me that? Over 65 or?
Not everybody.
No,
but-
not everyone, but a lot of people
Yeah.
are.
Yeah, and what I was saying was that most of the people who are eligible for SNAP but aren't using SNAP is our older population.
So to me, that becomes a target market that we want to try and capture. Find ways to make SNAP a viable option for our senior population. It's a very helpful thing, takes some of the stigma away from it, so that it doesn't feel like a negative.
For some of them, it's, well, someone else is worse off than I am.
Yeah.
They grew up in the Depression, like, they're good.
I understand. And that's culturalizing,
Yeah.
making it okay to say, this is a valuable asset to our community.
The other thing, I was just talking to Michelle Totten with DHS about like what if we put SNAP applications into the bags that people get at the pantry, or like other things like that. Because we were talking about people not using SNAP, and she was like, "Well, they're really pushing us to make sure that people sign up online." We were just talking about how the older population doesn't like to do things online, so that's, I'm sure, one of the bigger reasons.
But that's what the people at the health department do for people to be applying for the Oregon Health Plan. They have application assisters.
Right.
There could be times when they could go to the senior center and do something just on a volunteer basis to help them sign up. But in answer to your question, there wasn't enough money. They dedicated every LCAC dollar to this, and it only lasts 8 months.
Yes.
And they had to limit the number of vouchers that they gave to people, just because you can spend a lot of money on food.
No doubt about it.
But then that's why we built into this. I mean, if you're food insecure, the only thing you're not eating, you need to eat more than fruits and vegetables, which is why now when they screen for food insecurity, they're also saying the food pantry are these hours and here's what your eligibility is in X, Y, Z, so that they can get other staples. Hunger's hungry.
As we start talking about expanding the SNAP program, does DHS have the capacity for that influx?
On the national level, the discussion is to reduce eligibility for those programs, but there's nothing we can do about that. We just have
I'm
to-
just wondering, do we have the capacity, do they have that capacity currently?
I don't know.
Funding wise?
Yeah, whether Michelle's group, the DHS has. the-
Funding, and
whether
that's
the
like
funding
employees to handle that, like to accommodate that. So you have to go in and sit down with a caseworker or whatever, I mean, so that it's gonna take additional manpower potentially. Is that something that is that gonna be a hurdle for us, a barrier?
On the adults and people with disability side of things, yes. We no longer have a Lakeview, Lake County-based APD person. And they're hiring,
Oh, right.
and they're hiring a DA, like on the child side of things, I saw that
Caseworker.
classified, so,
Yeah,
I don't know.
I just did that.
Apparently DHS, they like to rotate people into positions so they can move up. They're not very good about rotating people in to backfill those positions, so.
We have less than 15 minutes. Sorry about that, so I just rushed through the southern issues. The funding options for food insecurity is EOCCO, USDA, and the Farmers Market Coalition, and local contributions. Any suggestions for any other funding sources?
EOLA?
We wouldn't be a funding source, I mean, we would be.
A partner.
Right.
It would be an in-kind maybe.
Yeah.
The VGRX is coming from them, right? EOLA and Gobi and everybody else, so that's definitely going to be the funding source.
Under that USDA umbrella, right?
So the next priority is substance use, abuse, addiction. The problem identified was, so the first thing we wanted to focus on was changing the culture of alcohol consumption. I can't tell you how many times I've been in community meetings, and we have discussed this issue in Lakeview and Lake County that for some reason alcohol is taken very lightly. There are many stories of, and I don't want to name any names, but people give examples of, oh, I had my first beer when I was 13 years old. And and it's just taken as, you know, even if you're aware that there is an issue, but people don't think that they need to focus on it as much. And also if substance use, abuse or addiction is brought up, the first thing people think of is meth or heroin or those kind of drugs, while in Lake County, I guess alcohol is number one problem. Yes?
Yeah.
Commissioner Williams.
Yeah, actually, I met with the Drug and Alcohol Commission.
Okay.
Dr. Richardson was talking about this, and it's not solely a Lake County problem. Apparently in the state of Oregon, 1 in 10 people between the ages of 12 and 60 have a substance use disorder. And it's 70% of that is alcohol.
Yes.
Those are national stats.
That's
too.
an
It's
actual,
one in 10.
and so the actual number is probably higher than that.
Okay.
Because that's actually just a number we know about and that we can actually capture.
Yeah.
So alcohol is actually a really big issue. Lake County is one of the counties that has a big issue with it. But yeah, I just thought I'd add that in a little bit.
Yeah, thank you. The next goal is, again, substance use, abuse. It negatively affects the community's well-being. For the goals, and Francie helped me with that one. So what we came down to is that we need an overseeing committee with representatives from the hospital, the law enforcement, wellness center, probation and parole, government, and the school district. And Francie was mentioning that we did have a committee of this sort. It's called LADPC. But again, I think they were not regular, and all of us wear so many hats. So it's just not possible to dedicate more time. So again, the idea was
what
that.
What does overseeing mean? Is it over? Did you mean to say oversight? SIGHT? So, I mean, I don't know what an overseeing.
So what I was thinking about was that for law enforcement and probation and parole and school district and hospital, we can all share information with each other. Because the idea was that probably we have to inform the community about it, but we need some hard data to tell them that no, this is an issue. So this committee can share information with each other, and we can throw hard facts at the community, like this is a big issue for us. So that's what I meant by overseeing committee.
That might too, sorry, I didn't mean to interrupt, but the idea of creating accountability within those groups to one another. If law enforcement is reporting to the whole group, like, hey, we saw this many MIPs, we've busted this many parties, if that, I don't know that that's happening. I mean, if there are numbers out there from Lake County, I have not seen them, and they would be super useful in my job.
I believe that's the LADPC's function.
Yeah.
I
Talked about it a couple times.
I believe it is.
Say
And the
that
county
acronym.
commission,
What's the acronym?
the LADPC, Local Alcohol Drug Prevention Committee or something like that, I'm not sure exactly, but there's too many acronyms.
I know, I can't think of all.
I got you. But the county commissioners are actually designate what group that will be. Back in the day, it was UPIC, which is the old coalition. Then they changed it and they made it the advisory council for the board for the now wellness with this mental health. So that mental health board is really supposed to be functioning as the LADPC because you have law enforcement, you have crisis, you have wellness, you have the hospital is there, you have the school is there, and that's where I think, guys, I could be wrong, but where that is supposed to be sharing and happening there. But when I came on, they didn't even know that that was their goal, and so every once in a while, I'm like, guys,
Well, this is the first time here.
and so, but I have been to one meeting, they're like, oh yeah, no, we've got you, we understand that's our function, and so I'm like, can I come to meetings now? But it's something I believe we could iron out and we could do better, because that information is not where we would like it to be yet. You know, the sharing of information, the process is not smooth.
Are there going to be barriers with sharing information between these?
There will be some HIPAA issues there. Capturing,
Statistics.
The statistics and demographics of it, you're probably looking for a little bit of that, I'm guessing.
Yeah, that's all.
And so it might just be an issue of just making sure that we capture that number and then that we share it. And I suppose there might be a breakdown there a little bit. So,
De-identified is fine to
Yeah.
share, so.
Can we think of any other goals other than forming a committee?
Is that being focused on youth, or is it just countywide?
Countywide, all go.
Countywide.
Yeah.
Youth would be good, though, I mean, I'm not putting you on the spot, but I mean, prevention
I mean,
coordinator, what
absolutely.
do you think we should do?
And we did add youth
If we
leadership.
know how many, drunk driving things, if we know what the current thing is going on, the trend, we're better able to address it,
I know I've seen things like in communities, usually it's shortly before graduation, they'll do like a mock horrific fatal accident, and that car sits there for the last week of school.
Our
or,
kids, the
you know,
youth
things like
leadership
that.
group were, proposed that, and it was decided it was too soon. It was not acceptable at this time for the community. She just explained that. But what they did do was they did a safe and sober campaign and a safe and sober post-prom party thing and funding from my grants, and we went in and worked with them, and they gave a whole bunch of campaign stuff on issues and wrote letters and posted things and did social media and all that for us, and then they got money to help with their prom. So that was the temporary thing. We'll see what they decide to do next year, but they would like to do that kind of a fatal crash kind of a situation in the future, but we have to wait till it's appropriate.
How long ago was there a fatal crash?
Noni, 3 years? 3 years ago. Yeah, and Keith, who was convicted, his kids were still in school. That was my
Been a while.
So our vendor Christie's looked at it before, and John has too, but there's a campaign out of Montana State University called Most of Us.
Yes.
And it's about community norming, and their best work is on traffic safety and early intervention on drug and alcohol
Yeah.
use.
I'm familiar with it too from my work.
Going to the action plan for the substance use. So first thing we thought of was to promote behavioral health and substance use dependency integration in our primary care. Increase community awareness with alcohol abuse and find ways to reduce it. Support local ordinance against smoking lounges. cannabis advocacy.
And the only reason that's up there, excuse me, is that they had the state tax for tobacco. I'm like, that's just not gonna be a starter in our area for right now. We're still, don't think we can get retail licensing in our area yet, but what we can do, the next 2-year plan with a local TPEP and myself, is to look at this issue of smoking lounges, because we kind of don't want to get caught with being unaware and suddenly have cannabis smoking lounges allowed in our town. So we think that maybe being proactive, we could go to get some people to go and you know, speak against that and see if we can get an ordinance that, so they don't sneak in and get that to happen.
Are you looking for an ordinance specifically against the lounges? Or dispensaries, or like?
The dispensaries creating indoor smoking.
Because the county actually does have an ordinance against the dispensaries in the county as a whole. The town has an ordinance allowing it. I'm trying to put you on the spot or anything, Darrell, I'm sorry. I'm trying to throw you in the butt.
It is what it is.
I just, and the county can't lift that in any way, shape, or form, because the county was proactive in making sure that it went to a vote of the population, and it was a resounding no, we do not want it here. So the only way that could ever be overturned is if your population demographic changes dramatically and you put it back out to another.
Can't they go in and do a local within the Lakeview though, just like they did with the dispensaries?
So I haven't heard of these lounges being set up because specifically you can't smoke in the building.
Right, but that's what they're fighting in the valley.
And most other, you can't smoke in a bar anymore. I mean, so this is very interesting that these are getting set up. So I'd just like to know, and then just have model code that you can send to me, and then we can present it and adopt it. That's no problem.
That's kind of on our new plan.
Yeah, we'd be glad to do that. Just send me some information. I'll be more than happy to spread it.
Oh, okay. I got a meeting at 9.
Yes, John?
Just in terms of the strategy around like increased community awareness, so I know isn't that really what Debbie Utley and Ann Kasbaum previously, they had funding in a program provided through mental health. I really don't know like the success or the impact of that program, but here we are talking about it, and so I'm just wondering if we want to be thinking about kind of new approaches, such as the Most of Us campaign, or these kind of positive community norming.
Exactly.
So it's about, instead of just educating, it's about how do you change values, beliefs, perceptions around an issue, and so
that's positive social norming, and the whole concept of positive social norming and the science behind it was in the transitional period between, and they had the DFC, the drug-free communities, 2005, they had it to 2005 to 2010. And they came in that period of time because I was working in the field with DFC in Nevada. And for some reason, that shift did not strongly happen, according to what I've seen just in the records, did not strongly happen in this county. I don't believe. So the trend and the science behind positive social norming is something we still really need to work with here. Exactly what you said. Values, character, all that. Because wagging your finger and telling them doesn't work.
Shaming.
Yes, it doesn't work. You cannot scare them to health.
Right.
It's pointless.
And you can't legislate morality.
No, you can't.
I just want to make sure that's pointed out too. Just having an ordinance doesn't really help all the time unless you can actually enforce it. And I'm struggling. I was out on ride-alongs last night till midnight, and I can tell you, our guys are overworked. They're tired. They're on the verge of burning out. Even with the additional officers, we're about to lose them to the academy, and we won't even have them here for our fair this year. So that's yeah.
Won't that be interesting?
But and alcohol is actually, that's one of the big things on our list, because alcohol and substance use is an issue during fair, a big one. You always have the guys that will call in for a 911 call, an ambulance or whatever, and they'll be faking it for attention. And then there'll be the guys who are really having these issues and the drunks that get out of hand. And I was talking to 3 officers last night, not a single one of them are looking forward to fair.
Oh, bet not, yeah.
But because it's always, there's a lot of pressure and there's a lot going on and they end up bearing the brunt of whatever horrible situation that occurs.
And what really has to happen is what John was saying. We need to work to build the will within our community so that the law enforcement knows they have the support of the community for doing that. Especially, I'm going to say, with underage drinking, because it's a hotbed. And I've talked to law enforcement, and, that's kind of where we are. That's what our social norming needs to do, is begin to do that. And that is not going to be a magic wand.
No, it takes a lot to change the culture. I took his first sip of beer when I was 9 years old. Fortunately for myself, I hated it. And I never took another sip of beer again. I was not really, until much, much later in life did I ever even taste another beer.
He's straight Pendleton now.
Last 3 years.
There you go.
Might be. But I feel like we are, as a community, especially in Lake County, we are making really cool strides in that direction. The fact that we're having this discussion here about this, that means something.
And the kids at the youth leadership group, when we had discussions with them about what do you want to do, and they came up with the idea of the crash thing. And they said, we're really tired of being told all the time, you guys drink, you guys drink. And they're like, we think the adults ought to be held responsible for providing. And I'm like, oh, boy, amen, okay.
For providing the alcohol?
Yeah.
Yeah.
Well, that's pretty clear.
Yeah, I know, it's like.
It is, but it's
Furnishing
real.
alcohol to youth is.
That's against
Yes,
the law.
but it happens,
Yeah, I
and
mean,
it happens a lot, and
Jill
anecdotally,
offense.
it happens in places that it should never be happening from.
Yeah, no.
And so we have a big,
Yeah.
we have a lot to work with in this issue.
Well, and I've heard more parents say, well, it's not illegal if they're in their own home.
Yeah.
Which is true.
And just to be
Yes,
clear,
it
when
is.
I took my first sip, it was not with my parents in the room. It
Yeah.
was someone else that was not even related to me saying, you should do this. I was 9 years old. What do I know?
But it's only
Yeah.
your child, it's
Yeah.
not all their friends that
Correct.
are also.
Right, yeah.
So, I mean,
Well, if I
it's-
give my child a drink in my home, then it would be okay.
Yes.
That should not be okay.
it
I
shouldn't be.
mean,
And
I know we
it's-
shouldn't be telling people what to do with their kids, but
And that's when.
they tell them not to smoke in the car now.
Conversation.
And
I have a
all
question, just for time's sake, this is super unrelated, but, vaping?
Yes,
I was next on that.
I don't think we have already
Candy
agreed.
is still nicotine.
Can we put that up there,
And
please?
myself, we've already agreed to work with, both the schools have asked about it, and North Lake was really adamant, and we've already made a commitment to do something and create an event for them. And I'm gonna guess that since they're looking for it, we'll just do the same thing probably, or something similar-ish for down here in Fur Lakeview. So we're yeah.
On that, I think it's really important that we don't assume that the youth understand that vaping is nicotine.
Correct.
They do not understand. I have first-hand knowledge of this.
When we did the show in North Lake.
And adults don't either.
No,
There's
they
some
don't.
young adults, I mean, I don't know, I know about people in their 20s, and the people I
Yeah,
talk
they
to.
don't
are
understand
just
the dangers or what it is.
Or the other thing, there's people who work in healthcare who are now, like, that I know very well, using the, like those, it's snooze, it's like packs of nicotine, and they're like, oh, it has nothing bad in it for you, here, have
This is
some.
actually something, thank you for putting that on there.
Yeah.
That's actually a really good.
So.
It's a big one. It really is. We did with the show that we did in North Lake, which was youth advocating to youth, so performing for youth, but all these different subjects. Vaping was one of them, and 79% of them on the post survey indicated that they learned that gambling was a activity that bore risk, And they also, was 73% understood now that vaping had the dangers and all that associated. So that was a pretty good thing for an hour show, we thought. And we thought, okay, that's part of why we're trying to get Ford Family Foundation to expand our ability to tour regionally.
A question for Paul, is that at all on EOCCO's radar as far as, we collect data regarding, do we have smokers, but smokeless tobacco is not currently something that is screened for, are they talking about it?
No.
Wow.
Or on purpose not talking about
Well,
it?
because it's not the EOCCO, it's the Oregon Health Authority that tells us what to measure for.
Right, I guess that.
So can we advocate
So
for them
if
to
this
look
wasn't
at it?
on OHA's radar, they would not going.
Oh, it's definitely on the
I'm sure they're
OHA,
talking
hip
about it,
condips
but they're
radar.
not, they probably don't know how to handle it.
It's a big deal.
So I want,
I mean,
how much, do we have a time?
Yeah, sure.
I want to update everyone. I actually got in touch with a group called Clear Alliance. They're out of Redmond, and they formalized act right after cannabis became legal in the state of Oregon. And I am taking Mary O'Sullivan, who works for the county, up with me to Redmond this month for a training, a formal training at their facility to educate us on the actual dangers and all the things that are incorporated around vaping and nicotine and smoking, because I've heard from 2 principals in this county that have said this is the first time in their entire career of being a principal and working in the schools that they go into a boys' locker room and it didn't smell like farts. Because it smells like strawberries and cherries and everything else, because everyone's vaping.
Yes, and they can use a Juul and nobody even knows.
And they're doing it in class actually now to see who can get away with it becomes a game. So we're gonna try to educate, we're gonna try and bring this into the classrooms. All the principals are on board with me, Will and Jack are on board.
I'm
We're
your
trying to
Huckleberry.
at least bring this to the schools where the kids can get educated.
I'm clocked in.
So I just wanted to update everyone on that I'm working on that to try and bring that, because they're in 30 of the 36 counties. Lake County is not one of them. And we have no training on that in our county at all, in any one of our schools.
And what happens is when the
But we
kids
will.
get caught with it, they get treated in the same category as a tobacco user. Okay, so I can tell you that if you were using a cotton candy flavored vape that you admitted to the police officer, well, I wouldn't take drugs or tobacco or anything from my friends, clearly do not understand what they are taking, and they're being given tobacco cessation
That's
courses
where the
to help
education
rehabilitate them, that isn't going to be very effective.
Yeah, there has to be an awareness about nicotine. Yeah.
There's just such a big variety and so many subsets of different minor drugs now, and there's zero education. I was just in high school, I feel like, yesterday. And all we had to know was like just a few things, and then now there's everything. And so you were told, okay, you smoke tobacco, it's bad for your lungs, that's all you need to know. Because there wasn't all these little subsets of everything. So now people are like, oh, okay, I'm not smoking anything, it's not bad for my lungs, it's not bad for me.
It's an acceptable alternative.
Yeah, so we don't know that all these different pieces all have their own different harms. I think it'd be really valuable for like maybe from a prevention side, to break down the different harms of like chewing, of the vaping, what that's doing to your lungs, of the substances.
Or the rest of your body?
The rest of
Yeah,
your
but
body.
it
like
can't be
nicotine.
scaring them to health. I
No,
did a
but
webinar on
understanding
vaping
it.
yesterday.
Thinking it's harmless?
Out of Canada, no. But the deal, what the kids say, statistically, is that they want to hear from peers. They don't want to be lectured, and they want to hear from peers. And that's why we're taking the direction that we are. We're training kids to be able to speak, to understand the issues, and then we're going to use them to do that.
These peers are also seeing adults doing these things, and I think it'd be like
most cases.
Jump in on that.
I apologize, we'll have to rush through, we have more than 10 minutes.
Okay.
Any other funding options for this priority other than Lakehead District, Gobi, UCC?
Maybe we're looking into whether we can get the DFC grant.
DFC?
The
Drug-free
drug-free communities, because the UPIC, the county technically had it before, but this group, we are a coalition. I don't
We
know
are,
how
but
you
we've
can
had it
go
for 10 years. It would be very tough for us to get. There's people that have been applying for it for years and haven't got it yet.
Yeah, but Christie didn't write that.
That's true,
right.
but I've had
Grant
DFC,
approvals.
I've worked under DFC for 10 years, and my concern would be that we're not there and we don't have the capacity yet, and then we can have it later, because there's a lot of I's and T's and so, yeah.
Yes, John. So, the Robert Wood Johnson Foundation, Culture of Health, has an investigator-initiated research to build a culture of health, and I'm looking at that as a possible opportunity for positive community norming projects through the region, and so I'd be interested in talking with you and just seeing if it would make sense, or if there's a possibility we could collaborate on a regional proposal.
There you go. Cool.
Thank you. Next, we'll go to our fourth priority, obesity and chronic diseases. This is the most simple one because it's purely clinically related. You don't think so, Paul?
No, it's definitely community, but it's the most straightforward of our activities.
Yeah.
I mean, what's written there is, I mean, first of all we have is self-reported information from the behavioral risk factor surveillance system. People get on a phone call and someone asks them, how tall are you? How much do you weigh? And then that's how we get what the body mass index is of your community, right? Whereas we know that, well, Nom's gone. I mean, because there are patient-centered primary care homes in North Lake and here,
We have the hard data.
It's mandated, so we can get 85% of the people in Lake County and de-identify and say, here's where obesity has occurred.
Well, and even more, I don't know what they're doing up in North Lake, but in the Lake Health Clinic, they ask every patient. So it's not just their DOCCO patients, so we know every demographic of people that come into that clinic.
Right, and they do. It's for everybody up there as well. So, I mean, I think that's the first place to start, is actually getting that information in a format, and you got that as objective number one.
Reusable data.
You know, and the other, I mean, when John was doing the Community Health Improvement Partnership, promoting the utilization of stuff, it's all through Outback Strong. I mean, it's getting people to do things. And the only thing I'd add somewhere in there is, I'm not sure whether it was here or in Harney, but even if it was in Harney, it's a good thing, is that people do things as family.
Yeah, that's.
Was that here? Okay. I mean, I would emphasize that somewhere.
When it comes to doing things in Lakeview or Lake County, I'm kind of optimistic regarding that. Last year we did the iDrive with the OSC extension, and we had an amazing turnout. So whenever we give an opportunity to the community about being active or something to do, the whole family can do together, same thing for the summer food program. I feel at least 30% of them are just there because the kids are having a good time and they just stay, they don't even take the meals. So yeah,
But again, yeah, it was here, because I remember the folks who were talking about a trail system or something like that.
Yes.
You know, promoting that kind of stuff.
Yeah.
You know, all fits into Outback Strong
And the chamber is on board with that, and all of their initiatives are going the same direction, and so it's tying in really well.
Right. Yeah, and recently we put up new signages for all the trails and we got a really good feedback. Chamber of Commerce did that, right? The signage? Yeah.
Oh, good.
Yeah. And Darwin, to give you a heads up, Jamie and I, like, we've got playground equipment coming at some point for Super Optimist Park, but Jamie, both in her capacity with the Extension Service and on the Trails Committee, we're interested in whatever we can do to support the town to help make Super Optimist Park like a cool destination that's really taken care of and the community takes pride in.
So the goal is again increase the opportunity for community education and participation in programs, which we already do a bit with our Living Well programs, discussing healthy lifestyle changes and education on managing chronic conditions. Action plan, measure the prevalence of obesity through Lake Head District through electronic health records.
I would add other clinics there too. I mean, get Lapine Community Health Clinic, and even Warner Mountain would have that.
But are they willing to
Sure.
put in the time to give it to you in a usable format?
We'll get Dave on board.
We have to hire someone, same for North Lake, actually their data person's last day is tomorrow, so.
But there's people in,
The person we're trying to hire, that other grant.
There's people in Lapine that can run that stuff too. If they're a patient-centered primary care home, they better be able to do population health management. Or we're paying for.
The next action plan is to support utilization of weigh-ins, diabetes self-management education and support group, which again are active at the moment, and living well with chronic conditions. Third action plan is to promote opportunities to exercise with families. More programs that are similar to
Shouldn't
eyesight.
pain be under there as well, because obesity and chronic disease and pain are hugely
Yeah,
linked
no,
together?
it can be.
Okay.
I didn't think about that.
Francie, do you guys do weigh-ins now?
No, that's not part of our thing.
Any funding options can we think of for that priority?
Well, I'm working on
Did you guys, John, did you guys form a park and recreation district here?
No, we completed the county master plan, so park and recreation master plan. Or, what was it? Chrissy, do you remember the master, was it a park and rec master plan?
Yeah, it was just a parks plan.
I think, well, I
But it was.
So I looked into
Yeah, it was
the
short,
the
sweet,
feasibility of
just
establishing a park and rec.
A district, okay. Well, if it's not
Yeah,
here,
it's one of the
that's not a
goals.
funding source.
It's within the plan, yeah.
Yeah, it's in the plan, but we
Is
just,
it? Cool.
but it, I mean, again, it's, you know, matter of
Do
actually
we
doing
need a
it.
bond measure?
Well, you'd create a district and then
Yeah,
that
right,
district
okay.
has taxing in play. But yeah, somebody's gotta fly it to make it.
I thought the issue was that the county is maxed out in terms of applying additional taxes. So if you were gonna create a new district,
Yeah.
you'd have to take funding
From some-
from the school district and from the health district, which would be a big, it would be a tough sell on the
Yeah,
public.
that's what we're told. I didn't understand that. I don't know how you can max out
Maybe worth looking
that.
into.
Yeah, it's definitely worth looking into. Just want to take the plan.
So in the next 2 weeks, I'll be sending out a lot of emails to the council and all the other departments just to get the final report. So up till now, we are kind of on board with the rough draft. Of course, there'll be changes made to it. Paul, is there any other step? I need the approval of the LCAC and submit the final report, is that it?
Yeah, I would do an opt-out
Okay.
with your email to the group, and that means everybody's in and supports the plan unless they object to something. So that our vendor is not looking for a bunch of, you know.
return emails.
Yes.
That's good, great.
And then that would need to be to us, ideally by the 26th,
Okay.
Wednesday the 26th, because we have to send all the plans to the state on Friday the 28th.
Okay.
But the 26th is the Regional Community Advisory Council meeting, so I'll give you till the 27th, but
You better make that the
that,
24th.
actually, that's in Burns too. That's as close as it's gonna get, Commissioner. I can just tell you that.
It's okay. It's all right. I know. It's okay.
Thank you. I apologize, we went several minutes over time.
Several.
Well, these ones
It's our
always
fault.
take time, that's.
There's a lot of stuff up there to go over.
As long as I can make it.